come in contact with anybody who's also got fever, which is very common with flus. So viral fevers, we suspect. Next slide. When a patient has a high grade fever without chills generally, but if there are chills, we generally consider urinary tract infection or the fever has gone to the chest, which is called pneumonia. Generally, patient presents with dry cough and they have a minimal mucoid sputum, which is just white in color and it's not either yellow or green. They can have a non-specific splitting headache, which is very uncomfortable. They can have generalized body ache, leg pain, back pain, joint pain, and a runny nose, sneezing. So these are the general common presentations of influenza, which we all commonly call flu. And specifically in this flu season, we should be aware of these symptoms. So next slide. So when we do a clinical examination, we keep in mind if the patient has high pulse rate or has a low pulse rate. We check for the respiratory rate if the patient is breathless. One slide previous to this. So if the patient has tachypneic or the respiratory rate is high, and then if the rate is high, then we think the infection has traveled from the upper part to the lower part, which makes it more serious. We record the temperature. We check the blood pressure. If the infection is severe, the BP drops. If the patient becomes dull and drowsy, then either the infection has become traveled to the brain, which causes encephalopathy, or we start looking for other causes, viral infection of the brain, which is called encephalitis, or it could be a malaria traveling to the brain, cerebral malaria, or it could be meningitis. So we have to see what kind of a clinical picture it is. Next slide. When we do a clinical examination, we check the throat. And when we look at the throat, we look at the oral cavity, we look at the pharyngeal wall. We see if it is red, if we look at the tonsils, if they are enlarged, if they're angry looking, or if there are any pus points in the throat. Then we examine the chest. Then we examine the heart and see is there any increased heart rate or extra sounds. We do the abdominal examination, look for the liver size, for the spleen size, and sometimes if the patient is complaining of severe headache, neck pain, and is drowsy, we look for the signs of meningitis. So this is the examination we as a doctor conduct. And after conducting examination, going through the symptoms, we give our clinical opinion, what kind of patient we are dealing. Patient can be managed OPD based or patient needs hospitalization, how serious is the patient, and how fast we need to act, or just like patient needs just a symptomatic relief with good paracetamol, plenty of fluids, rest, what kind of treatment is needed, we decide after doing a complete history and evaluation. And then, depending on patient's illness, we plan to order the investigations. If the patient is sick, we order the complete blood count. We ask for the peripheral smear if we are specifically looking for malaria. Then we ask for a chest X-ray. We do the platelet test. We are keeping in mind the possibility of dengue. There's a dengue season specifically during rains. Then we look for a urine examination if we are thinking of UTI. We do different tests which serve different purpose, which helps and aids us in confirming what our clinical impression is and what our findings are. So after we have taken the good history, examined our patient, done initial investigations, which generally include, next slide, complete blood count, dengue test, malaria test. Sometimes we have to do COVID PCR or a flu PCR, or we have to do different serologies to confirm our test. Sometimes we do blood culture to see if it's a typhoid. Then Vidal, which if it's coming after 7 days, then we do a sputum test and a blood smear. We do a chest X-ray, urine test, liver and kidney test, which gives us different information about how aggressive the illness is. Next slide. So if it's an uncomplicated viral, we give a symptomatic guideline to the patient. Please take rest. Rest is best treatment for any viral. Most of the time with complete bed rest, a proper diet, warm fluids, and just a home cooked good diet, most of the virals settle down. You give them paracetamols, antipyretic. If they have a runny nose, you can give them anti-allergies and allergic medicines. That's how you handle. And within like 2 to 3 days, most of the virals they have a self-limiting nature and they settle down. There are very few patients who need hospitalizations, and that category of patients they become very toxic, very sick. They have high grade fever. They can become breathless, and the BP can drop, and they can have giddiness and a lot of myalgias. They are the ones who should be taken to the emergency and completely evaluated. As I previously discussed, not all virals can be taken casually. About 10% of them can land up in the hospital. They can have an aggressive course, and depending on aggressive nature, a lot of virals they can turn into severe illness, and patients often land up in ICUs. So 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 what are the warning signs? If the temperature is more than 40 degree, then we have to be very alert. You can create a good ventilation. So that's how you try to cool the high grade temperature. Next slide. When when exactly we consider antibiotics, which is an important, treat a patient, don't undertreat a patient. Antibiotics are considered only when we think of a secondary bacterial infection over a viral infection, or a patient is immunocompromised, which could be a diabetic patient, which could be patient who's on steroids, which could be an elderly patient, which could be patients who are immunocompromised because of any medication they are on, or any HIV patient, or it could be if a patient has a hospital-acquired bacterial pneumonia. That is the time you have to pick up a good antibiotic, hit the illness, and get a control over the illness. Next slide. So, can we turn to, yeah. So in this slide, I have shown different areas which can be hit by the virus. So viral illness can cause a viral myocarditis. It can cause a viral bronchopneumonia. It can cause a viral meningoencephalitis. That means it hits the brain. It can affect the gut, which is called viral gastroenteritis. It can affect the platelets, which we often label it as a dengue, because that's a viral illness which hits the platelet. So it can any viral illness. It attacks various systems, so we call it a systemic illness. So it can have various effects, and depending on the intensity, as I discussed, it can turn into life-threatening complications if it is very severe. Next slide. So in this, we have seen a slide in which patient complains of a chest pain, and they can have a high-grade fever, they can have rusty sputum, they can have a blood in sputum. So these complaints they have to be taken very seriously, because as you see in the X-ray, almost half of the lung is hit by this infection. This is called a pneumonia. And these pneumonias, they have to be treated aggressively. Most of the patients need an ICU admission. They have to be treated with appropriate antibiotics. They need oxygen. They need support. And since the disease comes with a aggression, it has to be properly dealt, because we lose a lot of patients with pneumonia. Pneumonia is to be taken with a lot of seriousness, specifically if it affects the elderly age group, if it affects diabetics, if it affects any immunocompromised patient. So next disease, again, commonly caused, the next slide, brain fever or a meningitis. So patient often presents with severe headache, high-grade fever, nausea, vomiting, and they can come with a blurring of vision. So this, with this history, we often suspect if the infection's gone to the brain. And in this, we examine the patient, we check for the signs of infection to the brain, the neck becomes stiff, we raise the leg to check for the signs of meningitis. And if it is meningitis, then again, it's a race against time. You have to hit it hard. Then you have to do a lumbar puncture to confirm what is the kind of meningitis. So it's a very valuable time when we are suspecting this kind of a presentation. So we normally, the patient again comes in a ICU, or in a, even if it's not ICU, it could be a observation area, and you have to take monitor the patient very closely, because patients generally consciousness is very dull. They complain of high grade fever. They have to be appropriately treated with a good antibiotic which goes to the brain, and you have to see the progress. You check the lumbar puncture, do the test, and evaluate and confirm which kind of infection it is. It's a viral or bacterial, or what kind of bacterial, and you have to get the complete control of a situation. Then in the next slide, there are different zoonotic infection. By zoonotic, we mean the infections which are transmitted from animals to human beings. So the animal which could be transferring could be a rat, it could be a mosquito, it could be different animals. So one disease is called a Weil's disease, which we get from sewers, from the rats. And the patient generally, next slide, presents with jaundice. We'll come to the next slide. So the patient comes up with jaundice. They can have hemorrhage in the eyes. Can you please change the slide? Yes, and patient often presents with muscle pain. So they have a bloody eyes. They can have a deep jaundice. They can have effect on the kidney. They may not be able to pass urine. So that is, I'm just letting you know, it's more like a awareness that the rats, the mosquitoes, the animals, they can all be sources of fever, and they generally come with acute fevers, very short duration, within 5 to 7 days. Next slide. So you do different tests to confirm the diagnosis. You can do a Weil's antibody ELISA test. Next slide. Again, we can skip the slide because it's more for medical students. And this can lead to pneumonia. It can cause kidney injury. It can affect the brain. So different areas, and it can cause bleeding. Next slide. So we treat these patients with appropriate antibiotics like doxycycline, amoxicillin, and you have to suspect these diseases timely and hit them hard. So whenever you suspect, and you get the clues from examining the patient. Next slide. Then hepatitis, which is a very common illness. It's caused by food and waterborne infection. You can get hepatitis A, hepatitis E. So patient presents with nausea, vomiting, headache, fever, and they can have progressive jaundice. And when you check the liver functions, the liver enzymes are very high. And once you get this kind of a picture, you have to confirm if they've eaten from outside or if uh, any contaminated source of water they have consumed. So when you do the LFT, you find jaundice and increased liver enzymes, and you patient may be vomiting and dehydrated. You sometimes have to support them with IV fluids and give them appropriate treatment. And you can confirm what kind of jaundice by carrying out various viral tests like hepatitis A, E, and then hepatitis B and C are the different ways you can get it with transfusion, or you can get it from other sources. Next slide. Then septicemia. Now, septicemia is a severe infection in the blood. So it can be because of any source which is in the, which could be a pneumonia, which could be urinary infection, which could be from the intestine, the gut infection, and the patient comes in a very sick state. So when it circulates in the blood, it can go to different organs. So it causes multi-organ dysfunction. And most of the patients often come to the ICU, or they come in a very sick state. Their BP can fall, they may be breathless, they can have high grade fever. So they can come with kidney or a liver derangement. So there could be different ways to present. Next slide. So normally we manage most of the patients in ICU. Admission is mandatory. We have to give them appropriate antibiotics, and we have to take care of every organ. And despite best of our efforts, there's a very high possibility we may be losing few of our patients. Next slide. So again, as I have discussed, the virals which affect the platelets, dengue, we often get dengue cases in the rainy season. This is also one kind of a viral. And when we get a fever, most of the patients, they have been, they've experienced it either in their family or relatives or friend during the epidemic time or during the time when dengue is prevalent. If a patient has high grade fever, they get their platelets and they come to us because there's a lot of awareness in the public. The most of the patients, they present with high grade fever, they have severe eye pain, they can have body ache, joint pains, and they are generally dehydrated. So hydration has to be taken care of. And source, we all know it's a mosquito bite, and that's why during that season we repeatedly hammer it to everybody that please wear clothes which are full sleeve, cover your legs, cover your hands, and take care of yourself. Try to avoid any water collection. So small measures you should take so that we can prevent mosquito from harvesting in the area, and they are a threat to us. Next slide. Dengue can be again very serious if it turns into a dengue hemorrhagic fever, because then you can have bleeding from various sites, and the platelets generally count as less than 20,000, and if it's less than 10,000, it becomes critical. There's a leakage in the capillaries, so patients, they come with breathlessness, water in the lung, water in the abdomen, and they are swollen. They're again very crucial. It's very important to manage these patients in a correct area. They are generally sick. You have to give them platelets, IV fluids, sometimes plasma, and you have to take them often in ICU, give them support of oxygen. And unfortunately, dengue hemorrhagic fever also, the losing a patient rate is quite high. Next slide. So this is different ways we check the BP change the slide, please. So dengue, most important point I want to highlight in this slide is that first dengue may be mild, but the second dengue is generally very aggressive, and that's a dengue which causes seriousness, and that is a dengue which we fear. So once our patients have had dengue, generally counsel them that please be careful in the years to come, because the next dengue, if you get an episode, it will be more severe and you will be sicker. So, and a sicker patient, if we can get over dengue, we generally check if they past history, we can check the IgG antibodies, and if they are IgG positive, it is the second illness which has made them serious. So this second infection in a dengue is quite serious. Next slide. So chikungunya is another illness which, again, it's a mosquito is the vector which spreads, and most of the time the presentation is patient presents with severe joint pains. They are incapacitating, that people limp, they need a wheelchair, they are very uncomfortable, sometimes they can get rash. There was an epidemic of chikungunya where we lost a couple of patients. That time it was very severe, but generally chikungunya is not so severe. With that epidemic year, patients had kidney failure, they had meningitis, and they had severe skin manifestation. But usually chikungunya is more like severe joint pains, and it makes their life difficult, especially mobility is lost. It can last for a few weeks and goes on to a few months. So that's again incapacitating character of chikungunya. Next slide. So can we change the slide? Yeah, febrile neutropenia. Again, and it's an important condition. I just want all of us should be aware, specifically when we are dealing with patients of cancers. Again, they come with a very short history of fever. And during those chemotherapy, the good cells, the neutrophils are lost. The immunity gets suppressed. And even a short duration of fever can be very serious because the defense is very weak. So these patients, they can have any kind of infections, which has to be dealt with all good antibiotics, antifungals, and we again have to be very aggressive. So I'm just highlighting more for a awareness thing that these are called febrile neutropenias, short duration fevers, which can have a very aggressive course and generally in a chemotherapy patient. Next slide. It's a very, very common illness, and most of us, some point in life, we've gone through it. It's when we eat outside, especially street food or food which is not hygienically cooked, or maybe some problem with our water problem, sewage, mixing of our own water which we are using for drinking, then we can end up with enteric fever. And this fever generally has a very high grade, it's high grade fever, very hectic character, and patients generally present with headache, vomiting. They're very uncomfortable, and by second week, they need admission because they are dehydrated, they have toxic, and when we evaluate them on examination, we find some clinical clues that large. When we do the blood culture, we can find Salmonella typhi growing, and we get different clues in viral and other tests.
Pooja, this is for all, this is typhoid, what we are talking about. Everybody understands enteric fever as typhoid fever.
Yeah. Sorry, I should have told you. I agree with sir. And when we talk of enteric fever, we're talking about typhoid fever. And it's an important and a very common fever. And I think most of the people are aware of it. But one thing I need to discuss with my friends who are there, that commonly people, they come with low grade fever, or they say we have typhoid. So typhoid, if you come with a viral positive, because most of the labs in the these suburbs or small towns, they give a viral positive without even because they are very accustomed with this test, and they give some positive to the people also very often. The next is brucellosis. I just want you guys to know that if you're having milk which is not properly boiled, and if some handling cattle, they can have fever by brucella. It's a cause of fever which we should know. Next slide. Then urinary tract infection. It's a very common infection, specifically more common in females, and even males can present with urinary tract infection, but generally they will have a reason to it. They could have a stone or prostate problem, but in females it can be common, specifically in marriage babies. So it has to be dealt with appropriate antibiotics, and if the infections are repeatedly, they need a proper assessment. So next slide. After urinary tract, the next slide. So again, in this, I will just give you a brief idea. Scrub fever, it is caused by this tick infection. Then there are other causes of fever, which could be gout or could be arthritis. And then there are certain other conditions like bleed in the brain can give fever, heat stroke can give fever, thyroid storm can give fever. Then there are other skin infections which can give fever. And there's some autoimmune conditions which can give fever. So the last slide, next, I will just give a take-home message that acute febrile illness, we should always take them with consideration, caution. 90% of the patients, they generally have an uneventful course and they would have complete resolution. But those 10%, they have a potential of fatal complications. We should keep in mind, we should go to the hospital timely, connect with your physician, and if the patient becomes very sick, you should get them admitted in the appropriate area, which could be an ICU, and a complete evaluation, physical evaluation, investigations. Sometimes reassessments are needed, lab results are repeatedly needed, and diagnosis should not be postulated too early in the course of disease, because we have to see how the disease takes a shape. Empirical antibiotics are sometimes needed because they could be saving a life-threatening infection, and they have to be given by a person who's dealing with it day in, day out. Thank you so much. Next week.
Pooja, another thing, there's two things I think. Tuberculosis also is one of the causes of fever.
Right, sir.
And some cancers which are undetected, but they still can cause low-grade fever, and we recognize them only when it's been a month or 15 days. But these are not acute febrile illness, so we should not even ignore even 99 fever, which has been continuing for, let's say, 10 days, 15 days. You should definitely go and see a doctor.
I totally agree with sir. When these are, in fact, most common fever in India, which is not getting solved and carrying on, is tuberculosis. But since I was dealing with acute febrile illness, chose that I may not discuss in this forum. And cancers, definitely, sir, I agree with you. If the fever is continuing, few of the malignancy, especially liver malignancy, kidney malignancy, lymphomas, they are presenting this fever. And those we should keep in mind. And that is what I thought, that if the fever is not getting resolved, they need to meet a physician who can take it forward appropriately.
Thank you, Dr. Pooja. It was very nice. Now, Dr. Richa.
Yes, doctor.
We are open for questions. Anybody wants to ask, you can pose the question. I mean, they can send an SMS to you.
all the forums, those who are present, all the people, you can raise your hand, and then one by one I'll call the person and you can ask for, we have, doctor, we have 10 minutes for that. And then rest, whatever will be remaining, we'll take them over mail and then we'll forward to Dr. Pooja and Dr. Mehta.
Sure,
So,
sure, of course.
So anyone? So let me start with my question first. So Dr. Pooja, you just talk about meningitis. So I'll share my own personal experience on that. That when my the child was a little younger, around say 8-9 year old, so he was suffering from acute fever, and then we were treating the normal treatment which is there for the viral fever, but he was vomiting a lot and he was complaining for a lot of severe headache. But still the doctors were not able to diagnose anything, that what is the problem, and he suffered for 2 days, almost 2 days. Then fortunately we were able to get to one doctor, wherein he said that though I am 90% sure that it is not going to be meningitis, but why don't we go ahead and get the blood test done, so that we can at least rule out that there is no meningitis, because as per the circumstances there should not be any meningitis in this case. And to my surprise, that and to the doctor's surprise, it came out that, and then we immediately, at least we were on the right track of taking the corrective measures and take the action. But the only thing which I was feeling guilty was that because of our incompetency to identify that what exactly was the problem with the child, he has to suffer for 2 or 2.5 days. Whereas the same thing happened within a week's time to my the other son. So over there, we were very clear, okay, these are the symptoms. So we did exactly what was needed to be done, and we got all the tests done, and then they all got treated and they were fine. But how as a parent, you can identify that, okay, this is the very serious situation wherein you have to do all the measures which you can take.
So I agree with you that during that experience, like 2.5 days of just suffering with severe headache and vomiting would have been painful. And that's what I said, that knuckling down. If the headache is very severe, the child is holding the head, and if there's blurring of vision, or there's a photophobia.
All are requested to please mute your mic.
So photophobia, or means you can't tolerate light and you're vomiting, that you raise the leg up to see if the meninges are getting irritated. If there's any doubt, it's always safer to do the test, which is lumbar puncture. Give them appropriate antibiotic, because time is very crucial. Brain infections, certain infections don't give you time. And if the damages are there and they go unchecked, or you miss them, then it definitely affects the child, or it affects the patient. So crucial time and correct assessment is very important in certain cases.
What I want to say, Dr. Pooja, I think we should have a very high degree of suspicion in diagnosing people who are going to get sick. After they get sick, if we diagnose, there's no point. But idea is to pick up those 10%, like you said. Those patients have to be picked up very early, and that can only happen with a very high degree of suspicion and increasing number of tests in those patients. That is where you said the ability of the doctor counts.
Right, sir. And when we are dealing with sick patients, often the test number is high, but that is important and required to lead to the correct diagnosis. Time is very valuable. And acute illnesses which are coming aggressively, it's almost like a race against time. You hit them hard and you get a control over them.
Thank you.
Thank you so much, doctor.
Thanks.
Yes. Anyone else? If you want to ask something, you can just unmute and ask your question.
Okay. Good evening, sir. Good evening, ma'am.
Good evening.
My question is, at the initial stage of this illness, would there be some home remedies for some initial relief that we can take? Because
So,
many people would like to take, would like to go with home remedies. So if there are any home remedy for the initial stage of this illness, which can give some relief, what would be that home remedy?
home
By
remedies,
you mean
in one of my slides.
no medicines? Allopathic medicines, you mean?
Sir, not exactly allopathy medicine, but like we use like maybe turmeric milk or some home remedy which could give us some relief at the initial stage of this illness. Because I mean we tend to avoid going to doctors. I mean, to be very honest with you, yes, we prefer to go to doctors once we have the severe illness or severe pain or something. But at the initial stage of the pain, or which is not very severe, but yes, we can avoid the situation where we could have the severe pain, something.
Pooja, can I answer it?
Yes, sir, please do.
Okay. What I mean is, see, if you have fever which is 99, less than 100, you don't have to give any antipyretic or something known as paracetamol or any other drug which lowers fever. And obviously, when you want to give turmeric and milk and kada, like a lot of people, warm milk, but that is only in cases where you have common cold, low fever, and you have a sore throat. Those things can help. But if you have joint pains which are not going, and in the first initial 2 days, if you have to use paracetamol can be used, but all other home remedies, they're not causing any problems. Problem would come if you are ignoring a problem which is like 102, 103 fever and continuing for more than 1-2 days, then that will cause a problem. Home remedies are gargles, like you said, turmeric milk or even warm water. They just soothe your throat, and they're basically symptomatic treatments. Pooja, you can add more.
So I agree with sir. So home remedies is they are supportive, and as sir said, you should not ignore it, because if there's you're using turmeric in every vegetable which is cooked, you're taking milk every day. So if these are going to work, nobody will have viral. If viral has happened, yes, you take a paracetamol, you can take additional turmeric milk. But I don't think so that will turn around a viral. It will just give you comfort, home food, proper diet, comfortable environment, rest. Most of the time, body is fighting back in these virals, and these food and all are supportive. But if it is not getting control, then that's a time that you should react and go to a person who's professionally trained. They will give you guidance how to handle it. So it's not that you should rush the first day. You can wait for my first slide started at least 2 to 3 days. Wait, if the temperature is more than 38.5, that is the time you should react to any acute febrile illness. So all these things are good, but they are not treatment for viral. They may just, yes, it has been age-old saying that haldi milk is good, and then some kada also people talk about. You can have it I have nothing against it, but they're not going to change the viral.
Okay, ma'am. Thank you.
Thank you, Dr. Pooja. Thank you, Dr. Ashwini. Swati, you can ask your question now.
Okay, hi, hi, Dr. Pooja. So my question is, yes. So, so usually when you have fever, on the first day you take medicines like paracetamol and crocin to subside it. So is that okay? Or is there any other way we can, any medicines that you recommend that we can take on the first day of the fever?
No, Swati, you're doing the right thing. If you have fever, which is more than 99.5, 100, please take a paracetamol to make yourself comfortable. So that's called a symptomatic relief, which is most needed in any fever. Unless you're comfortable, you should stop working, take rest. So that's perfectly fine. Paracetamol, whichever brand you like, Crocin, Dolo, Calpol, it is immaterial, but you should take that, take rest. And then if it's very high, you can do a tepid sponging. You can use a proper ventilation. These are the regular ways to take care of any fever, common fever which we encounter. So I don't recommend anything specific other than paracetamol. The painkillers, Nimulid, it's not an approved drug. In fact, it is one of the banned drugs because it causes, it can affect liver, and sometimes it can give a severe reaction. The other medicines like Meptal, sometimes when the fever is very high, unrelenting, and it's not settling down with paracetamol, Meptal we often prescribe our patients. It gives a better relief. But in this dengue season and all, we don't recommend anything which comes in the category of a painkiller, which could be Combiflam, Meptal, or any Vovarans, because anyway, patient has a tendency of platelet fall.
And another
Thank
thing
you
I
so
want to
much.
add, Dr. Pooja, that one more thing is that rest is important, diet is important, fluids are important, and initially only paracetamol is important because it does not affect your platelets or any other fall of other blood components. But another thing is that please stay at home. When you have fever, runny nose or something, don't come to the office. Don't give it to anybody else.
I agree with sir, because we are the sources also. One patient is another, it's a source for another 5. And that's how all these flus get transmitted. So it's our responsibility. If we are unwell, we, by doing a self-isolation, we are actually halting the transmission of disease, and which is very important. Plus, it helps us get better very fast. So it rest at proper time, you can shorten the duration of fever to maximum 2 to 3 days.
Swati, I think it's clear.
Yes, yes. Thank you so much, Dr. Pooja, for answering my question. And thank you for the
Sambhav, we can have your question.
Hello, hi Dr. Pooja. So basically, just want to understand, like the way it happened in the pandemic. Do we also need to kind of quarantine ourselves in terms of the fever which comes?
Sorry, I couldn't follow, please.
He wanted to know, in these acute febrile illness, do you have to quarantine like in COVID?
Yeah.
You don't see. What I will say that if you got a flu, anyway, one flu patient, the rest of the family or people you are coming in contact, the transmission is going to be there, and all virals get transmitted very fast. COVID speed is much faster. It's also kind of viral. But if you self-isolate, you are actually taking care of your colleagues, your loved ones. It's not that it's like mandatory. Even if you keep a distance of 3 meters, and when you are sneezing, when you keep a hand over your mouth, and you're taking all those precautions, you're wearing a mask, you can reduce the transmission to other person significantly. And by doing this, you are creating less patients and you are helping the society in general. So yeah, this is in acute febrile illness. Specifically, we are talking about flus. Other conditions like if it's a loose stool or it's a urinary tract infection, of course, your isolating will not help, or isolation is with respect to respiratory complaint only.
Thank
Dr.
you.
I think all of your queries have been done. Should we come to the end of the? Anyone else?